We've talked a bit about hospitals. We've talked a bit about health insurance and healthcare access. And one thing that has come up multiple times that we haven't delved into is medicine. So now it's time to talk about drug companies. The top 20 pharmaceutical companies ranked by revenue in 2023. Accounting for the changes of high and low end rankings and sales of COVID products. At the top, Pfizer seated number one slot as its revenue tumbled 41% from an industry record of $100 billion in 2022 to $58 billion. Drug maker, I don't care. Top spot in 2023 list is Johnson & Johnson, which had sales increase to $85 billion. Roche, which ranked in sales of 58.7 billion Swiss francs, which is $67 billion. I just want the rankings. Come on, give me some. Here we go. So at the bottom of the rankings, we're still in the tens of billions of dollars. Yeah, here we go. 85 billion for number one. 65 billion for number two. 60 billion for number three. Oh, it's 2 out of 3 so far in New Jersey, and the fourth is New York City. 58 billion. Top 5. Let's go. And 54 billion. Cool. One outside in Chicago. Now, I bring up the actual profits for these drug companies first, just to get a basic outline. How do prescription drug costs in the United States differ compared to other countries? So, more than 3 in 4 adults in the US think that the cost of prescription drugs are unaffordable. Nearly 1 in 3 adults said that they haven't taken their medication as prescribed due to cost. Just let that sink in for a second. 1 in 3 adults don't take their medication as prescribed because it's too expensive. In 2019, the US spent more than $1,000 per person on prescribed medications. An amount higher than any other peer nation. So $1,000 per person per year or per month, because I would argue that number is much higher. But per capita prescription medicine spending in the US 2004 to 2019, obviously we are significantly higher than that of the comparable country average. Germany is the next closest to us, and then Canada, Japan, Switzerland. The UK actually has quite cheap drugs as of 2019 at the very least. 1,126 per capita on prescribed medications, while comparable countries spent 522 on average. This includes spending from insurers and out-of-pocket costs for patients for prescription drugs filled at the pharmacy. The per capita prescribed medication spending in the US grew by 69% from 2004 to 2019. Lovely. Nice little comparable chart here. The US per capita insurer payments and out-of-pocket spending on prescribed medications are both higher than any other comparable country. Private and public insurance programs cover similar shares of prescription medicines spending in the US compared to peer nations, on average 85% and 84% respectively. However, the steep cost in the US still contributes to high US healthcare spending, and are passed on to Americans on the form of higher premiums and taxpayer-funded programs, given that retail drugs account for 18% of the total health spending of employer plans. Beyond this, it's not only just that. It touched on it here, but I didn't quite like the wording. The cost is passed on to Americans by taxpayer-funded public programs, like Medicaid, but that's just because the drug company is charging Medicaid more for the drugs. That's like, it doesn't need to happen. There is no need for that price to be that high. Now, can I do this without the sun directly glaring in my face? No. I like the lighting, but unfortunately, it's blinding me. And blinding you. So, down you go. My eyes, like, I literally cannot see right now. So, prescription drugs cost more in the US than comparable countries. Prices of select prescription drugs in the US. So, this Hep C medication costs $31,000 in the US, where the average comparable country, $23,000. Now, I don't know why this medication costs this much. And it could validly cost this much. Like, obviously, when you produce something new, and especially with like a medication, there's a lot of research and development that goes into this. There's a lot of other things that are going on behind the scenes that are influencing the cost here. But also, there is, I don't trust these drug companies. Like, even the comparable average, if it takes $5,000 to produce this drug, they're likely selling it for 3 to 4 times the cost. I don't believe that it should cost this much to begin with. Of course, when something is new and it's harder to replicate, the cost is high. But as you continue to do so and you invest more into it, the cost should go down, not up. And US drug prices have continued to go up, not down. And really everywhere in the world, like comparable countries, almost none of these are going down. They're all trending either consistently or slightly upward. And us just flying up the top. But it doesn't need to be this way. Even for just like a blood thinner, there is more than $100 difference. Now, the prices of many brand name prescription drugs are used to treat conditions, and brand name drugs versus generics is a complicated topic. For the most part, generic drugs are exactly the same. It comes down to a copyright issue, whereas if a drug company creates a patenting issue, not a copyright issue, sorry, YouTuber brain, but it comes down to patenting law, and that's why brand names tend to stick around, whereas once their patent ends, of course there are generics that pop up, but people will still buy the brand name, and the brand names are significantly more expensive, but there isn't much a education into generic drugs versus non-generics. The amount of times I've had to like tell people that I know when they're going to the store and they buy ibuprofen to just buy the CVS brand, the store brand ibuprofen, the allergy medication that you're taking. You don't need to buy the God, I'm blanking on their names, but you can buy the store brand, and they're almost exactly the same. The only difference would be whether you prefer like a liquid capsule to like a normal pill and all of that stuff. But people are not educated on this. They don't know that Tylenol isn't Tylenol. Tylenol is a different chemical that is sold under the brand name Tylenol. But you don't need to buy the brand name. You can just walk into your grocery store and they will have their own version of it that's like a third of the price. This same system still applies for prescription medications, for the most part. Newer medications don't fall into newer medications will still have their patent on them. And so making generics of these medications, sorry, it's medicine time for me, so I'm just doing that. These medications don't have generics, so you're forced to buy the brand name, which costs obscene amounts of money. But those trademarks are supposed to be, those patents are supposed to be limited. And once they run out, then other companies start making cheaper variants. Really, this same chemical, because it takes like 10 years for a patent on a medication to wear off. And by that time, the process of making this has been so well studied and so perfected, it just wasn't legal to make for cheaper than the company that owned the patent. And so we get cheaper drugs. But people don't know about this much of the time. But even then, they're still being overcharged quite a lot of the time. Countries' prescription drug policies can be based on a number of factors, including regulations or benchmarks on prescription drug prices, the number and types of payers, and the role of pharmaceutical benefit managers, patent protection of drugs, and the availability and price of generics or biosimilar alternatives. In the US, drugs with no competitors can be more expensive than in other countries, in part because the US does not directly regulate or negotiate the prices of drugs. When generics or biosimilars become available, these lower cost alternatives can offer less expensive treatment options. Now, as I said, it's a complex system, but the two most important things here is regulation and the availability of generic medication for a lower cost, both prescription and non-prescription. Generic drug share of prescription drug market. Now, 90% of share of dispensed prescriptions versus 19.8% of prescription drug spending. I don't understand this graph. Right, so oftentimes generics are what's dispensed. Most people do get their medicine as generics, but this only accounts for 20%, just under, of what the actual cost of these medications are. Not actually the cost of what these medications, this accounts for 20% of drug spending overall, which means that the 10% of drugs that aren't generic account for 80% of the cost that is being passed on. Many of these drugs don't have available generics. I know for a fact that Vyvanse was one of these, where it recently, like the Vyvanse patent expiring. So just in February of last year is when the patent expired for Vyvanse, which this is a ADHD medication, and this is a very expensive medication. Now, as far as I'm aware, and from what I see, there still is no generic Vyvanse availability, because we have a shortage of ADHD medications in the United States. Adderall, for one, is a big one that has a shortage. Vyvanse is a very similar medication. Has a generic version been approved? Yes. So we have just last year in August and the beginning of this year, we have approvals for some generic versions of Vyvanse. Now, as someone with ADHD, I have been prescribed this medication. And I remember back in 2016 going to the pharmacy to fill this prescription. And I had health insurance through the university that I went to. And it was fine. And I was getting my medication. And once I left university and I went to go fill this prescription again, it was just over $1,000 for a 30-day supply, which is obscene for really any medication. $1,000 for a daily 30-day supply drug is just unacceptable, especially when it does not cost that much to produce this drug. But the reason for it was patent law and a lack of regulation and caps on how much these drugs can cost.